Great. Hi, everyone. Welcome. My name is Surma. I work for NAMI Juneau. And one of the things that we do is try to make sure that everyone in Juneau is aware of the mental health resources that are available here. And so every winter, we update juneaumentalhealth.org, which is a website that we maintain. And one of the things that we do is help people navigate that resource. And so this webinar is kind of meant to be an annual update of just what the resources are and what's different about any of those resources, if there is anything different about those resources. So that's what we're going to talk about today. It'll be about, I think, 25, 30 minutes, and we can do Q&A afterwards. We're going to record this. We are recording it. You probably just saw a little warning, or alert is maybe a better word. So if you don't want to be a part of the scene on the recording, you can change your name, turn off your camera, all that good stuff. And then we can do Q&A at the end, and we'll stop the recording before we do that. So with that, actually one more second, and then we're going to get started. I'm going to open up juneaumentalhealth.org so we can run through it, look at it. So we keep juneaumentalhealth.org is separate from our website. I think it's like a relic of a bygone time, but I think it's kind of nice because I think it should be kind of a standalone thing that isn't associated with us. It's meant to be an objective reflection of what exists, which, doesn't have to be on our website to be a community resource. So I think there's probably pros and cons to it, but we've decided to have it be a separate standalone thing. So here is juneaumentalhealth.org. And again, this is the website that we update annually. People can send updates during the year, but we make it a point to update it annually. And what we try to do is capture all of the mental health resources that exist. So both the organizations like NAMI Health and Wellness and Juneau Human Services and Clinton Haida's Healing Center, as well as the individual private practice therapists, psychologists, and all those folks. So I'm going to walk through this, and by walking through this website, I'm going to hopefully touch on all of the services that exist. If there's something that you think is missing from here, please let us know afterwards, and we'll send you the form so we can get all the right information to add it to our website. So what you're seeing right now is the homepage. Meryl, it is up, right? I'm sharing my screen. I know how to use Zoom. Outstanding. And the first thing that we have is the community mental health organizations that exist in Juneau. And we laid these out on 3 different matrices. First one is adult mental health services. The second is youth mental health services. And the third is local substance use services. And each of these categorizes the types of services in that heading. So the adult mental health services, we have screening and assessment, individual, group, and family therapy, the different components of adult mental health services, both actual treatment, like assessments, like therapy, like medication management, but also support services like our support groups, supported employment and education, things that are kind of mental health treatment adjacent or additional things that are explicitly for people experiencing some kind of mental health issue. So on the cover of each of these matrices is a list of all the organizations that do this type of service, that do medication management, that do supported housing. And on the back is the contact information for all of them. So their website, their phone number, all that good stuff. So I think let's just go through it and give some updates about some of these organizations as we go. Like I said, we update these every winter. And so some folks gave us updates on new services that they want to make sure we mention. And some of them also wanted us to give information about their intake process. So I'm sharing the information that they have shared with us that they want us to share with you all. And when we do this, we are not making a judgment about whether anything is good or bad, and that's not the point. I think it would be absurd for me to even think that I have a relevant opinion about that. The point is to say what the organization does, how it works, how to engage with the organization, and what they say they do. NAMI Health and Wellness is a great organization if you want to get an assessment, and a horrible organization if you want to buy 2x4s. They don't sell lumber, right? So like each of these organizations does certain things and doesn't do other things. So we just want to make sure you all know what they do. So you'll see a lot of organizations listed multiple times. There's kind of a standard suite of services that community mental health providers offer. So you'll see like Bartlett, Search, NAMI Health and Wellness, Gastineau Human Services or Mount Juneau Counseling and Recovery. They use both names depending on which service you're engaging in. Search Behavioral Health and Clinton-Hyda's Healing Center in a lot of these. So I'm going to start by just going down those and letting you all know the updates that they all have. Bartlett Outpatient Psychiatry Services, they have intake forms on their website. So if you want to get screening and assessment or individual group and family therapy or anything else where BOPS is listed, medication management, you can download the intake application on their website and you email it back to them and they will contact with you and talk through how intake goes after that point. Search Front Street Clinic. You can call them for a self-referral and they will tell you the intake stuff. So you call them first and then you can get your screening and assessment, your individual group and family therapy, and all the other stuff that Front Street Clinic does. Jamie Health and Wellness for adults. They do walk-in assessments Monday through Thursday. And so I believe they do 2 a day. And so if you're one of the first 2 people there each day, Monday through Thursday, you can get your assessment done that day. There's days where there might be 3 or 4 people trying to get an assessment and not everyone will get an assessment. There's also days where fewer than 2 people show up. So you could call them at 10 a.m. and say, hey, has anyone claimed the 2 spots for today? And if not, you can head over there and get your assessment. They open at 8 a.m. So the earliest you can get there if you want to be indoors is 8 a.m. You can wait outside their door for as early as you want, if that's what you're into, to make sure you're the first person there to guarantee you get a spot. But that's how intake works at Jamie Health and Wellness, and that's for adults. We'll talk about their youth intake, which is different later. Mount Juneau Counseling and Recovery and GHS. You can call them or email them to get their intake packet. And after you turn in the intake packet, they can schedule an assessment. And I think it's worth mentioning that they have multiple different residential programs and housing programs. And I know that at least as of a few weeks ago, one of their housing programs had openings. So it was for people in recovery. It is not like intensive treatment. It's something after that. So I think if you are looking for people who are in recovery, who are looking for housing, I would call Mount Juneau Counseling and Recovery / Gastineau Human Services right now, because at least as of a few weeks ago, they had some beds and they were being very vocal about wanting to get the word out that those beds are available. Search Behavioral Health. Their intake packet is also on their website. You can also call to schedule an intake appointment. They also have, let's see, like a lot of the organizations, they do multiple things. They do screening and assessment. They do individual group and family therapy. They do case management. They do medication management. So Search is yet another place that does a lot of this standard suite of community behavioral health style services. Clinton-Hyda Healing Center. They have a referral form on their website. It's a very quick and easy form, which I think is awesome. So if you are a tribal citizen or I believe a spouse of a tribal citizen, and Nikki, if you can remind me of that, then you are eligible to receive Healing Center services, and the referral form is on the website.
Yes. Or so tribal citizens, which could mean um any tribe, a tribal citizen of any tribe, and then directly related to a tribal citizen. So not just spouse, but it could be like a stepchild too, or um yeah, a mother or father, which they might be tribal citizen too, but hoping that that makes sense. Directly related to Unishish.
Perfect. Thank you for that clarification. I appreciate it. I'm glad to have you on here, so we don't have to like send out an embarrassing clarification afterwards. That would be no good. The last thing we have listed here is private practice counselors and therapists, which I'll get to later because that's a different part of the website. So like I've mentioned a couple times now, the organizations that I just mentioned, you'll see them in a lot of these categories. So I'm not going to go down each category and review everyone, but I will mention a couple different organizations that do not do the standard suite of treatment things, but are still available to folks. So in terms of recovery, support, and education, in addition to Jamie Health and Wellness and Mount Juneau Counseling and Recovery, We do some support groups in education. We do trainings. We have regular support groups that are free for people to attend. No sign up required. So you can see that information on the homepage of our website. There's a little calendar with the trainings and support groups that we offer. Polaris House also has a dual diagnosis support group on Mondays from 4 to 5 p.m. I'm trying to quickly look at my little page here. Yes, Monday from 4 to 5 p.m. Dual recovery meeting. And similar to ours, it's free, it's drop-in, it's peer-led, and it's a 12-step self-help recovery meeting. So that's open to the public. So you don't need to be a Polaris House member already to attend it. As far as specialized services, Aware has housing and support specifically for survivors of domestic violence and sexual assault. Catholic Community Services has some specific specialized mental health services for seniors and their families. The VA clinic has specialized services for veterans and people who are eligible for VA services. And the UAS Counseling Center has outpatient treatment for students. And I think something that's news to folks about UAS is that you only need to be taking 1 credit hour there. So you don't need to be like a degree track person or living on campus or anything else to access those services. As long as you're taking 1 credit through UAS, you are eligible for their services, and they do it both in person and online. So, and it's all 3 of the UAS campuses, so Juneau, Sitka, and Ketchikan. As far as supported employment and education, the Department of Voc Rehab has a specific services in terms of employment support for people who have specific mental health concerns or issues that they're addressing. Jemmy Health and Wellness I mentioned, Polaris House, who I have mentioned, they also have employment and education support. So they'll help get you connected to CERC or get connected to Voc Rehab, and also have some agreements with local employers for different types of transitional employment opportunities. So Polaris House, great to talk to if you want help with housing, want help with employment, want help with education. SAIL also has specific services and to around employment and education, and they ask you to set up an appointment for intake. The intake normally takes 30 minutes. You can either do it in person at their office, which is about 10 feet above me right now, or over the phone. So SAIL has employment and education support services for people who are addressing their own mental health issues. And their intake takes about 30 minutes. St. Vincent de Paul, same thing, and CERC, which sometimes people know it as CERC, sometimes people know it as the Learning Connection downtown on Ferryway. They also have employment and education services, and they actually have quite a few. So they have GED prep, English as a second language, citizenship classes, college prep, workforce development, and they offer those things both online and in person. So if you want to access the adult education or workforce development stuff, participants can call them or email them. And registration takes about 15 to 20 minutes, and then you have a whole suite of services that are available to you. You'll notice I skipped over crisis stabilization. I think it's because I want to talk about that after I've gone through the 3 matrices. Crisis stabilization is kind of relevant to all 3, and I think it's its own separate thing. So I just want to save that and talk about it separately. That's the adult stuff. That's the adult gossip that we want to share with you all. Moving on to youth, you'll see a lot of the same names, and I'm not just going to keep repeating it because that doesn't seem helpful. But there are a couple things to point out here. I think one is that JAMI Family, it is a part of JAMI Health and Wellness, but they have a separate intake process. So I think it's worth knowing that. For adults, like I said, they have open intake, which means that you show up, and if you're one of the first 2 people, then you get your assessment done that day. JAMI Health and JAMI Family, excuse me, you call and make an appointment for the intake. And so that's specific for youth and family services. So they have a separate phone number. They're about a block away from me. I can see them out my window right now. Different building behind the Nugget Mall. And you can call them and set up a direct scheduled time for an intake and assessment. And then they have therapy and all the other stuff. Residential treatment, So on back loop, what was formerly Juneau Youth Services residential treatment is now operated by Search, and it's called Ravens Way. It's still in the same buildings that JYS was operating out of, and it's co-ed, 12 to 18-year-olds. Zach Gordon Youth Center has multiple services, some that are out of the Zach downtown, some that are at Shai Hot Hit, which is the shelter that on Mendenhall Loop Road here in the valley. So in addition to like those physical places, which are healthy, welcoming places for young people to be, regardless of what's going on with their mental health, they also have very specific housing navigation services that they offer, and transitional living program and rapid rehousing. And it's important to note that for some of their stuff, youth goes up to the age of 24. So by youth, depending on the housing program, it might also mean young adults. Helpful to know. The Juneau Teen Health Center is in JDHS and in the Zuntikahini building for Yakuzge. And even though it's in those two buildings, it's open to anyone who's high school aged. So you can be getting a GED, you might have just gotten your GED, you might not be going to school at all, but if you're high school aged, you can go to the Teen Health Center, make an appointment, and see a therapist for free. Great to know that that exists. And for family supports, so things that aren't directly treatment, but are still supportive, Aware has some youth and family support services for people who are survivors of domestic violence and sexual assault. We have a couple different groups and classes for people who are supporting a loved one's mental health. So like we have a support group on 2 Thursdays a month, family support group. And it's for people who are supporting a loved one's mental health, regardless of whether that loved one is a child or an adult. So I think for someone whose kid is newly struggling and they want to pick the brain of other people who've been addressing that with their kids for longer, our family support group is a great place. It's free, don't have to sign up, and you can get some advice from people who have been where you are right now. Clinton Head Healing Center also has some supports outside of just treatment. So you can go on their website and see what some of their groups and activities are. The ZAC, obviously, and Shai Hot Hit, which is the shelter operated by the ZAC. That is the youth stuff. Probably worth pointing out now that I'm saying all this and I'm showing you these resources. It's a lot to absorb and take in. And one of the reasons that we exist is to help people navigate all that stuff. So please, if you're overwhelmed about where to go or what to do, and you don't want to memorize me talking for 25 minutes, calling us or emailing us or whatever else is a great way to navigate all this stuff. So our phone number is here. We have an email address, namijuno@gmail.com. If you know our individual email addresses, use those. And we have a little contact us thing on our website also. So multiple easy ways to get in touch with us so that you can ask us questions. That's the youth mental health services. Let's go on to substance use. And similar to what I said for youth, substance use, you'll see a lot of the same organizations here. I'm not going to go through them again, but I think it's worth pointing out a couple things that are unique to this matrix here. Search has their comprehensive addiction services. That's the little log cabin building I can almost see out of my other window near the airport. And they do medication-assisted treatment. And they also do some counseling for people who are addressing their addiction issues. So they've really been developing their comprehensive addiction services lately. And they're running out of that large building, and a lot of people are using those services. So that is a Search program, but it is operated separately or concurrently. I'm not sure exactly what word they would use to their standard behavioral health outreach, behavioral health outpatient services. So if someone's looking for substance use services specifically, and they want them from Search, they should be Googling or calling for the comprehensive addiction services. That's who does their substance use stuff. Valley Medical also does medication-assisted treatment for substance use issues, so worth calling them. if you think they are going to be the best organization for you to do medication-assisted treatment. You'll notice they don't also have individual or group treatment. So if you are just looking for MAT, Valley Medical is available to you. If you're looking for MAT plus something else, then you would need to pair the MAT care you're getting from Valley Medical with some other provider. There are a lot of different recovery supports for folks addressing their substance use. 4As, which is about, I would guess, 35 feet down from me right now in our same building. They do syringe access. They do all kinds of supports. Their initial thing that they did was support people who have HIV or AIDS. They still provide that case management, but they have some other supports for people who are addressing their own substance use as well. There's AA and NA meetings in town, and there's an awesome website that's actually updated, which seems like such a miracle because there's so many websites that try to show you like what all the meetings are in a place, and they're always outdated. As far as I can tell, the AA and NA website is always updated, and that just always seems awesome, and always feel fortunate that that exists because I think it's sometimes hard for folks who are new to meetings to find meetings. JAMI has a couple different recovery support and education programs. Mount Juneau Counseling and Recovery has a couple, and Juneau Public Health provides a naloxone. So if you need naloxone, you can go to 4As. You can also go to Juneau Public Health. And I think that's one example of what we mean by recovery supports is medication that can reverse an overdose. Supported housing, we have Housing First, we have JAMI Health and Wellness, we have Mount Juneau Counseling and Recovery, and we have Clinton Haida's non-congregate shelter. And they provide sober housing and structured programming for individuals returning from incarceration, transitioning from residential treatment, or just currently in the community who need additional stability and support. So I think some people think of their services as just people returning from incarceration. I've heard that from folks multiple times. It's more than just that. It's returning from incarceration, transitioning from residential treatment, or just in the community who need additional stability and support. And they have intake forms online, or you can go there in person to access those supported housing services for people who are addressing their substance use issues. As far as specialized services, Hello Baby at Bartlett is something explicitly for people who are pregnant or within 1 year after giving birth. So worth knowing about for people who meet that criteria. I think that's it, except for the emergency services. So now we're going to talk about the emergency services. I'm going to go back to the adults tab, and I'm going to go to the second page of it. And we're going to see some crisis stuff. First thing we have is the Alaska Care Line. I think there's been some developments in the past couple of years that are ultimately good, but have also made things a little bit unclear to folks. You can now dial 988. That's nice. That's easy to remember. And it goes to the Alaska Care Line, which is a much longer standing thing. So it's a new phone number to access a long-standing service. The Alaska Care Line, folks in Fairbanks, and the idea is that you can call if you're in a crisis and or you're struggling and just want to talk to somebody. So I think some folks think that like you need to be suicidal right now and that's your only hope. And of course you can call them in that scenario, but you can also call them if you're just having a hard time and they will be there to talk with you. There's some folks who call pretty regularly who get some support that they need and some connection met that way. If they are all full, it goes to a different care line in another state, and all of the care lines that exist in that network all do roughly the same thing. They all like the same values and whatnot that they are supposed to adhere to when they're doing the thing. So you're calling the care line, you might get routed somewhere else. It's going to be similar. It might be a bummer that it's not someone who's also in Alaska. It's nice to talk to someone who has similar experiences to you, but you will still have like a similar conversation. Like the other organizations participating in that compact do roughly the same thing. It's worth noting that if at the end of the phone call, if at the end of them trying to be supportive, if they're still worried that you are at immediate risk to yourself and others, They might contact emergency services and they might tell you that they're doing so and they might not. So with all these tools, it's worth knowing how to use them and what they do so that you are not surprised or caught off guard by something that happens. So Careline, great tool if you want somebody to talk to or if you're in a crisis. And you can call yourself. And I've also a couple times called when I was with somebody who they like did want to talk, but was a little bit reluctant to call them. And so I put it on speakerphone and said, all right, how about if we call together? And they agreed to that. So that's another option. You can you can call them with somebody to make it feel more accessible or approachable. JAMI has an emergency services clinician who is like multiple who are available 24/7 on call. So when you call their JAMI's emergency line, you can get connected to an actual person in Juneau. Um, and so it's therapists. You can speak with them. They can provide a similar service to the care line where they can, try to be supportive over the phone. Similar to the care line, if they are worried that you're at risk to yourself or others, they might encourage you to go to Bartlett Hospital. You might decide to go there and think that's a good idea. You could potentially they could potentially engage with emergency services the same as the care line. And so that might happen. And the situation is all of a sudden no longer fully in your control, which can be alarming to folks who are not expecting that. So again, these are great services as long as you know how to use them and you're going in clear-eyed about what happens and how they work. We have a mobile crisis team in town. That's new as of about a year ago. And they are dispatched through 911. So you can call 911 and say that you have some kind of crisis going on yourself or somebody else. And you can request mobile crisis team. And especially when mobile crisis team was brand new, we were told that you might like want to explicitly say, hey, can I get the mobile crisis team? But it's ultimately the dispatcher's decision on who is dispatched. Because we have emergency dispatch that you contact by 911. They dispatch Juneau Police Department, Capital City Fire and Rescue, and the mobile crisis team. So they will decide based on their assessment of safety of the people responding, who is the most appropriate person or team to dispatch to any crisis situation. So if you're calling 911 and want the mobile crisis team, I think I would still recommend explicitly stating that you want the mobile crisis team, but also know that it's their decision of who gets dispatched. It might be mobile crisis and someone else. It might be just someone else. And they're available 7 days a week from 9 to 5. I heard yesterday that availability might be changing soon, but for now, that's what we know. 7 days a week from 9 to 5. And it's an emergency services therapist from Bartlett paired with a member of the mobile integrated health team from the fire department. And so similar to JAMI, but more in person. If you're in a crisis or someone you're with is in a crisis and they want someone to talk to, that's an option. It's a local person. They're mobile, so they can meet you in person. And I know like the mobile integrated health team, they do a great job of connecting folks with other resources. I think their role is similar to ours, and like they really value knowing what resources are available and how to get in them. And so they can be helpful to access other stuff after that interaction as well. So that's our mobile crisis team. And Search also has a 24/7 hotline. It is not in Juneau as far as I know, or in Alaska as far as I know. I think it's like a national service. I could be wrong about that. And I would open to hearing folks if that's not true. And then something that isn't listed here, but is listed somewhere is Bartlett. Maybe it's on the front. Bartlett Emergency Services. And so the Bartlett has the emergency room, and the emergency room kind of acts as the front door to the mental health unit in Bartlett Hospital on the 3rd floor for adults, and to Providence Hospital for youth, which is in Anchorage. So if you go to the emergency room, they are assessing for immediate risk to you or others. And based on that risk, you might be admitted to, as an adult, the mental health unit, or if that's full, API or somewhere else in Anchorage. And if you're a youth, you might stay at Bartlett until you can get to Providence Hospital. Providence Hospital is like the youth version of the Bartlett's MHU. So the emergency room itself um, acts as a assessment in an emergency. They're looking for whether you're an immediate risk to yourself or others. And so immediate risk to self, normally suicidal, but can also be delusional or otherwise having behaviors that are so dangerous to yourself that you're at immediate risk of harming yourself. If it is a suicide crisis, which that's the most common that I'm aware of, they're looking for whether you have a plan to kill yourself, the means or ability to kill yourself, and the intent to do so right now. That's the criteria for immediate risk to yourself. And if so, you might be referred to the mental health unit, and you might be given the option to go up there, and you might say yes or no. And you also might be forced to go there, potentially against your will. So worth knowing how that works also. So once you go to the emergency room, that's what they're assessing for. And things can sometimes go out of your control if you are found to be at immediate risk to yourself and others. That's how the Bartlett Emergency Services work. Um, that's the mental health matrices. Those are the organizations and what they do in Juneau. Like I mentioned earlier, we have the private practice counselors and therapists that I skipped over. And so let's go to that part of the website now. We have the private practice tab. And on this, we have counselors and therapists, talk therapy, sometimes in person, sometimes remote. We have psychiatrists, doctors who can prescribe medication, and psychologists, some of whom do things that are similar to counselors and therapists, and some of whom do more like in-depth diagnostic testing about um, brain functioning and processes to assess and diagnose what might be going on with somebody. So psychologists, I think there's like two different categories of psychologists. And we have a listing of everyone who has ever contacted us to be listed on here who provides services in Juneau. I think it's like 70 something people. It's in alphabetical order. We ask that each person to update it once a year. You see at the bottom of each person's posting the last time it was updated. Some people send us updates more often. So you see when it was last updated, and we have a standard list of information that we provide about each person. So their credentials, whether or not they're accepting new people, who they serve, their specialties, do they work with veterans, they offer substance use services, modalities, so on and so forth. And you can filter by some of those things on the left here. So you can filter by whether they see adults. You can click on that, and you'll see that there's 68 people who see adults. You can click on couples, and there's 23 people listed here who see couples. So you can use these filters to sort by whether they're accepting new clients, who they see, age-wise, insurance they accept, and everything else that's here on the left. So it's searchable by using the filters. It's searchable by just scrolling through each page and looking at folks and going to the next page down here at the bottom. And it's also searchable by typing in keywords. So maybe you have ADHD and you wanted to find someone else who says that they specialize in that. We have 18 people who explicitly said that ADHD is one of their specialties or mentioned it somewhere else in their little description of themselves. So you can use this search for anything that isn't filterable. That's our private practice listing. Folks often look at it and are overwhelmed by the amount of people, and it's not our place to know or say like, oh, that person's good or bad. It's very person specific. There is no good or bad, right? It's how would I know who's going to be the best fit for somebody? So I think the advice that I normally give is contact a few folks. You don't know how quickly they're going to get back to you. You don't know whether it's going to work. Meet with a couple folks, decide who's best for you. I wish I could just say, hey, you would definitely get along the best with Amelia, or it's so clear you get along with so-and-so, but I think that'd be pretty inappropriate of us to do. So that's what we do with this listing. That's the private practice providers. We also have a listing of support groups. If you notice that this is a little bit less beautiful than the other listings, I think you'd be correct. But this is what we got. Some of these are statewide, some of them are nationwide, some of them are local support groups. Our stuff is on here. AA is on here. Bartlett's groups are on here. And the reason we broke this out separately from the matrices is these things are not treatment. They're free. and they're kind of like changing more often. We didn't necessarily want to list like all these statewide organizations that just do like one group that might be relevant to people in Juneau on the matrices, but we did want to have a place for them. So this is where you can find the page for Bartlett's groups that they're doing at any given time. This is where you can look to see if there's anything that says grief, like Ock Bay Bible Church has a grief share. We're looking for autism support. If we are aware of it, it'll be on this listing. So this is like the free stuff, drop in or very minimal intake, and different than treatment. It might be peer led, it might be still led by someone who's credentialed or otherwise considered an expert in that thing, and it might not. But it's kind of like a grab bag of stuff that's lower barrier to get into often. And then the last tab is LGBTQ specific resources. So this is some stuff that we're doing, but it's also stuff that exists in our community. We have these little things that are also printed out that we share about LGBTQ local resources for youth, and some advice about questions to ask at a first therapy visit that's developed by Forge, which is a national organization that does a great job of promoting mental health in the queer community. So if you're looking for LGBTQ specific mental health resources, whether treatment or support, we have our tab on juneaumentalhealth.org that actually takes you to our NAMI Juneau page. What else did I want to say? Last thing I wanted to mention, maybe I'll stop sharing, is that there's two new organizations that are nationwide that provide psychiatric treatment, Medicaid funded or Medicaid billable psychiatric treatment online, Frontier Psychiatry and Rural Psychiatry Associates. And I think they're actually listed on our adult matrix. Is that right, Meryl? I
For
can go
which
back and
one?
look. Frontier and Rural Psychiatry Associates.
Those are not listed on the matrices. We haven't found a good place for them in our little world yet, but I can put the links
Gotcha.
in the chat.
Yeah, if you could put the links in the chat, that'd be great. Then I think just memorize this or ask us later if you want to remember it. There's two organizations that are nationwide, are online psychiatry, and that bill Medicaid. And that billing Medicaid is awesome because sometimes there's a whole bunch of time that you got to wait to get a Medicaid service in person. So just know that Frontier Psychiatry and Rural Psychiatry Associates exist. It's going to be on Zoom or something similar to Zoom. But if you have Medicaid, it's a great option to get psychiatric care quickly. So with that, we're going to stop recording and then we can do Q&A and you all can ask whatever questions you got. Meryl, can you stop the recording?